So at Reasons, one of our key philosophical tenets is a focus on wholeness and integration. So the idea is that we have behavioral interventions that directly target the eating disorder symptoms and behaviors. And at the same time, we're not just trying to move past them so quickly that we don't honor the role that they played in the patient's life, the way that they helped them cope with stressors and difficult relationships and painful things. So there's three key elements of the depth psychological approach that we use at Reasons. The first is honoring the symptom. So we work with our patients through the process of honoring the symptom and inviting it into treatment as a way to reduce the profound sense of shame and worthlessness that they so often feel about the eating disorder behaviors. So instead of looking at our patients as having some inherent flaw that needs to be fixed, we're looking at them as having wholeness inside of them, and that these symptoms have made a lot of sense in their life. So by honoring it and inviting it in, we're recognizing the many ways in which it's helped them cope and survive with the difficulties that they've experienced in their life, the psychological pain, the emotional distress, and relational disturbances. So once we've invited the symptom into the work, then we can move on to the process of meaning making. So we look at the ways in which the symptom has had meaning for someone, and then we also look at how does someone find a deeper meaning and purpose in their life beyond the eating disorder? So often our patients are asking the question, does my life have purpose? Is there purpose in life? And they're struggling with feelings of maybe suicidality or self-harm, or just general sense of worthlessness and self-hatred. And so in working together with them, we've honored the symptom, and we're looking at what are the unique gifts and talents that they have in their life that they can bring into the world. What are the ways in which they can participate in life in a lived, embodied way that has meaning for the long term, beyond the period of treatment, beyond the eating disorder. So the third thing is integration, and meaning making opens the door for integration. So once we've kind of discovered what are your unique value and gifts and purpose in life, then it's the act of living it. How do you bring it into life? How do you take the things that have been cast into the shadow and rejected and start to retrieve them and bring them back into reality so you can live a creative, full, embodied life? And that may be accepting the imperfect. That may be recognizing that you're good enough. That may be picking up that instrument again that you put aside. It may be embracing your anger. Any of those things are in service of integration and recognizing that there's dark and light aspects of us, and we can hold both of them, and we can live in this world embodied with both of those things. If you'd like to learn more, please visit reasonsedc.com.